Hi guys, and welcome back. In today's video, we're going to be contrasting conventional medical treatment of IBS with a more holistic approach. So on the one side, we're going to be talking about what you might get for your treatment if you were to go to your primary care or a GI doctor, perhaps an MD, DO, PA, or NP. And on the other side, we're going to be talking about what is more commonly the case if you see a functional medicine doctor, such as myself, an integrative medicine doctor, a naturopathic doctor, or perhaps even an integrative nutritionist or dietitian or acupuncturist. So stay tuned, we're going to break this down and we're going to figure out where they each have their strengths and weaknesses and where you can get the most bang for your buck. Let's start out first and foremost with how each of the sides manages things from a nutritional perspective and how they might advise you on modifying your diet in order to treat or at least manage your irritable bowel syndrome. Now, on the conventional side in particular, there's going to be two distinct variations. So I'll break this down depending on if you have been diagnosed with IBS-C or IBS-D. So most frequently when it comes to food, from a conventional approach, say like a GI doctor's office, if you have IBS-C, that is IBS with constipation, they're usually going to tell you hydrate, first and foremost, which I do agree with. I think that's worthwhile and worth your attention, and also increase fiber. That's going to be the pretty standard, stereotypical way that they're going to talk about diet. They're going to tell you to eat things like flax seeds and bran, and take things like psyllium husk, and really beef up the fiber intake. They might advise you to do it slowly so you don't shock your digestive system, but they're going to tell you that fiber will fluff up the old poops, moisturize the poops, draw water in, bulk up the stools, and then you'll be able to pass your stools better, which does work reasonably well for some people. If, on the other hand, you have IBS-D, that is IBS with diarrhea, then they're going to more likely have a conversation about what you should be eliminating. They might recommend that you do a low FODMAP diet. They might talk to you about the so-called gassy foods like beans and legumes. And they might even recommend something like gluten-free, although typically I don't see a lot of GI doctors recommend going gluten-free unless you've been diagnosed with celiac disease. But theoretically that could happen. So on this side, I'm just going to say restrict. If you're lucky, they'll set you up with an appointment with their dietitian. If you're not lucky, they might just either say, hey, reduce FODMAP foods, or they'll give you a single page handout. But typically, they're going to have more of a conversation around eliminating foods and being cautious with fiber if you have IBS diarrhea, and they're going to tell you to bulk up the fiber and add in a lot more fiber if you have constipation. However, on the other side of the world, on the other side of this schematic at least, the nutritional management of IBS from a holistic perspective usually takes a bit of a different turn. What I've seen is that there's not quite as much conversation about IBS-D versus IBS-C. Usually in the holistic, functional, integrative, naturopathic, etc. space, there's more of a conversation of eliminate and restrict. Uh-oh, my green marker's dying. That's usually going to be the emphasis. So whether or not they're recommending a standard like IFM type elimination diet, they might have you do low FODMAP, they might have you do low FODMAP SCD or biphasic, they might even have you do something like Whole30 or Paleo or AIP. There's a whole lot of different variations. Like I have met functional medicine doctors who basically have all of their patients, no matter what the diagnosis, do AIP. End of story. Every single patient is recommended autoimmune protocol diet, massive elimination diet, and they're off with like a handout and a prayer. Some people customize it quite a bit more. I am seeing that the integratively trained or functionally trained nutritionists and dietitians tend to be a bit more savvy with this, and maybe they're not going to be as keen on the restricted diets usually, and they're going to be more open-minded to customizing it to the individual. But from what I've seen within my own profession is a lot of functional, integrative, and naturopathic doctors have kind of their chosen elimination diet that they just happen to like, and they recommend it for the vast majority of their patients, and there's a little bit less customizing and a little bit less customizing and a little bit less critical thinking than I would like to see. This is actually where, in a weird way, the conventional medicine world sometimes pulls ahead, because at least they're dividing up the conversation depending if you have constipation or diarrhea. That's not always the case in functional medicine. It's just like gluten's evil, dairy's evil, soy is evil, eliminate all these things, good luck to you. So, for what it's worth. Next up, we're going to talk about what I will respectfully call Band-Aids. And this can fall into different categories, but oh my goodness, it should come as no surprise that conventional medicine really pulls through with a lot of Band-Aids. And I'm not even going to list them all here in writing, but just put a big old RX, because this is what the vast majority of the prescriptions are doing. They're not treating the IBS, they're not treating the root cause, they are Band-Aiding symptoms. And don't get me wrong, if you are really debilitated by your symptoms or if they're really impacting quality of life, it can be reasonable to have a Band-Aid on board for a short period of time. I'm not anti the use of Imodium or Pepto-Bismol or, whatever the case may be, or a laxative even. It's just that it's not treating the condition. It's just Band-Aiding the symptom, and you need to dig deeper usually. So, for example, if you're talking about IBS with constipation, typically you're going to see medications that are laxatives, whether they be stimulating laxatives or osmotic laxatives. You're going to see things perhaps, and it depends on what other symptoms you have too. If you have constipation and you also have a lot of abdominal pain, then you might be prescribed a pain medicine, you might be prescribed an antidepressant, you might be prescribed something like an antispasmodic to help relax those smooth muscles. But I usually see the antispasmodics used less in IBS-C because they can impede motility and slow down the transit and then cause constipation. So usually that's not quite as common with IBS-C. IBS-D runs the gamut a little bit more. So you have everything from things that will, anti-diarrheal medications, things like Imodium, whether they be over-the-counter or prescription, perhaps anticholinergic, antispasmodic medications, certainly pain medicines or antidepressants can be used, even anticholinergics, I said that already. Bile acid sequestrants is the other one that I almost forgot to mention, so something like cholestyramine. That is usually going to be dependent on what symptoms you have. So for example, if you have really greasy, fatty stools, you're going to be more likely to be prescribed something like cholestyramine, as opposed to if you just have run-of-the-mill diarrhea and there's no real steatorrhea or fat or greasy quality to the diarrhea, that's going to be a little bit of a different scenario. So all of those could be used. The ones that I typically see the most are things that slow down transit time. Things like Imodium very commonly are recommended by the GI world. The nutritional piece is usually recommended by the GI world as well. And also I see quite a lot of people who wind up on antidepressants and antispasmodics when they have IBS with diarrhea. Now on the functional, holistic, etc. side, there are going to be some Band-Aids. This one gets really tricky because the holistic professions all want to shout it from the rooftops that they are treating the root cause and they don't use Band-Aids and Band-Aids are terrible and why would you use a Band-Aid? But in reality, there is quite a lot of Band-Aiding in the holistic profession. It's just that maybe they're not quite as aware that they're Band-Aiding. I don't know. I'm usually fairly aware when I am Band-Aiding something, and I do honor that and talk about that with my patients. But examples of Band-Aids, oftentimes, boom, diet. Keeping you on a restricted diet for months or years or indefinitely is probably the most common and most egregious Band-Aid that is used in the holistic, naturopathic, etc. profession world. It's very, very common. And there's a lot of food demonizing, like grains are bad, meat is bad, fat is bad, and it's all just hogwash. These diets are not typically treating the underlying condition. They are Band-Aiding something that has happened. Now, I'm not one to criticize this entirely because as somebody with celiac disease, eliminating gluten has been life-changing. And for me as well, dairy is a super no-go. So I still, 10 years later, do not eat gluten or dairy. So it's not that the dietary restriction and the elimination diets have no purpose and they can't be used long-term. It's just, I find a lot of my patients who come to see me after they've been to another naturopath or holistic or functional doctor, very frequently these people have been told that they have to do paleo forever, or they have to do low FODMAP forever, or they have to do SCD or low histamine or whatever the diet is forever, and that's just not accurate. So this is probably the biggest offender as far as Band-Aids. There are others like Band-Aids that I use with my patients that I think are really helpful. Anti-inflammatories. Turmeric, resveratrol, ginger, boswellia, green tea, sulforaphane. I mean, fish oil, there's a gajillion of them. But anti-inflammatories in some way are Band-Aids because they are quieting down or band-aiding the inflammation to buy you time and increase quality of life and function while you're treating the reason why you're inflamed. And this can also be a necessary thing because if you just treat the root cause of inflammation, it might take a long, long time for the inflammation to quiet down on its own. So you can usually speed up the process of healing by using this anti-inflammatory Band-Aid piece, but realistically, anti-inflammatories are going to be a bit of a Band-Aid. Another Band-Aid that I use as an example is with some of my patients with IBS-C. I just need to get them pooping. I mean, there's no two ways about it. You need to be pooping so that we can get the antimicrobials and the probiotics down to where they need to go. We need to keep your motility from freezing up or backing up on you. And I've had patients who swear that a bout of constipation will precede a SIBO flare-up. And it seems to them like the constipation causes a SIBO flare-up. Makes total sense. Like it's a slowing down of motility more globally, and if we can just keep them pooping, then that can help mitigate inflammation and quiet things down and keep them humming along so as not to get an exacerbation of SIBO. So in order to get people pooping, sometimes there are things like aloe. Aloe is a really good, gentle, stimulating laxative that can be useful. Magnesium citrate, so things like Natural Calm can be a really good, just gentle osmotic laxative, pull a little bit of fluid into the stools. Even something like Triphala, the Indian Ayurvedic herbal combination of 3 herbs, has a little bit of a laxative quality to it. In addition to modulating the microbiota and being a bit of a prokinetic, it is a bit of a laxative. So these would be examples of things that I would be open-minded to in order to band-aid symptoms and get some improvement in symptoms and facilitate healing for somebody with IBS-C. So it's not that Band-Aids are bad, it's just, it depends how damaging is that Band-Aid going to be. And more commonly in the conventional world, are you fooling yourself into thinking that you're treating the condition when in fact you're actually Band-Aiding it? And then you wind up stuck on these Band-Aids for months or years or decades or indefinitely. That's my big beef with Band-Aids, is if you're aware that you're using a Band-Aid, but it's for a good reason and it's intended for a relatively short span of time, I'm cool with it. But if you get stuck in this limbo la-la land of, oh, I guess I'm just going to be on this antidepressant for the rest of my life, then that's where I start to pick apart the whole Band-Aid thing. And finally, last but not least, let's talk about how these professions actually treat the dang thing, which is actually what we intended to cover in this video in the first place. So the actual treatment, the bona fide treatment of the thing that's going on in people with IBS, it's few and far between in the conventional world, truthfully. Again, they have tons of Band-Aids. They likely will talk to you about nutrition at least a teeny bit, but the true, honest to goodness treatment of the thing, few and far between. What I have seen that I think falls in the realm of true treatment would be either antibiotics. So this would be things like rifaximin if you have IBS-D, maybe rifaximin and neomycin if you have IBS-C, and you have confirmed SIBO. Actually, as a side note, a lot of GI doctors are prescribing my patients rifaximin or Xifaxan without actually testing for SIBO. I'm really surprised how few GI doctors are testing for SIBO. They probably just know the test is imperfect like I do, but nonetheless, I'm kind of surprised by it. So antibiotics, whether it be just rifaximin or some combination if you potentially have methane SIBO, and I would say prokinetics to some degree are going to be truly treating what is going on. If you have had sucky motility for 10 years ever since you got food poisoning, then a prokinetic is actually about as close as you're going to get to treating the root cause of that. If you have had SIBO for God knows how long, and that is why you have your IBS symptoms, treating it with antibiotics is going to be the closest thing to a true treatment you're going to get from the conventional world, in my opinion. In the holistic profession, there's quite a lot more room for that. Oh, and I should say too, another one that sometimes they will do is they'll prescribe a probiotic. Sorry, little ADHD there. So sometimes there's a probiotic in the mix. Almost always, it's going to be the exact same one. I have seen it from almost every GI doctor in town now, and it cracks me up because it never works from my angle. They are almost exclusively going to recommend VSL number 3. And none of my patients have ever given me good feedback about that probiotic. They all hated it. They all felt worse on it. I might be seeing a subset of the population because if it helped them, then they probably wouldn't come work with me. But just for what it's worth, that seems to be the one and only probiotic that I ever see recommended from the GI clinics and, well, occasionally Floristore. But really it's VSL number 3 or bust, and it's not quite all it's cracked up to be. Now, back over here to the holistic side, the treatment of the thing, usually you're going to get a bit closer here. So whereas the conventional world is going to test you for celiac disease, Crohn's, colitis, C. diff, diverticulitis, and they're going to rule those things out, they're not going to get quite as close to an accurate diagnosis 9 times out of 10 because they're not going to be testing you for dysbiosis. They're not going to be testing you for candida. They're not going to be testing you, maybe, maybe not, for SIBO. They're not going to be testing you for leaky gut. So depending on your actual diagnosis and what's actually going on, you could get much closer to a proper treatment over here. So if you have leaky gut, then maybe your holistic doctor is going to recommend L-glutamine. If you have candida overgrowth, maybe they're going to recommend some dietary restriction and also things like caprylic acid. If you have SIBO, maybe they're going to recommend antimicrobials and prokinetics for the SIBO. If you have dysbiosis, maybe there is a particular probiotic they can recommend to you or prebiotics to feed the good bacteria. You could actually get much, much closer to a root cause solution and treatment, true treatment, not Band-Aid, with a holistic approach, usually. Again, my biggest beef with this world is that we tend to be really happy-schmappy about the elimination diets and restricting people too much, and then that has the potential to exacerbate and fuel the fire of dysbiosis and candida and potentially even SIBO. But overall, I think that most holistic professionals do a reasonably good job at trying to look for dysbiosis, candida, leaky gut, SIBO, etc., and then treating that as the need be. So there you have it, folks. That's the major differences between the conventional approach to IBS and the holistic approach. You can see they both have their claim to fame. They both have strengths and weaknesses. On this side, the conventional side, I mean, I think that they actually do, oddly enough, a better job of talking about nutrition in the sense that they at least have different conversations depending on your diagnosis in a GI setting. But my biggest beef with this world is that they are band-aiding your symptoms more often than not, and they're almost never getting to a true treatment. And even if they do, it's a half-assed treatment at best. They'll give you, 10 days of rifaximin and call it a day. So that's my biggest beef really with this side is the band-aiding and the lack of actual treatment. But, they do a halfway decent job talking about nutrition with the people that need that conversation. Over here, on the holistic end, I actually have more of a problem with how my profession handles the nutritional element of IBS because they very frequently have people on very restricted diets for prolonged amounts of time, and it's way overkill, and it doesn't need to be that hard. And they keep people on these restricted diets for way too long. So this is my biggest beef with my own profession. But I think as far as getting to the root cause and actually treating the dang thing, functional medicine, integrated medicine, naturopathic medicine, these guys are going to do a much better job at getting you the proper testing and understanding what is underlying your symptoms and then actually, honest to goodness, treating it. So you could potentially get the best of both worlds. You could do a bit of a workup and do some testing and maybe a colonoscopy or an endoscopy with a GI doctor, and then have this just initial little conversation about dietary management with a GI doctor, and then perhaps politely decline the medication side of things, and then find you a good naturopath, functional doctor, integrative nutritionist, whatever it might be, and then really parse out the more advanced testing, things like stool testing, leaky gut testing, candida testing, and then get to the actual treatment with these folks, as opposed to getting lost in the weeds thinking that you're treating something when you're actually band-aiding it. So that's probably how I would do it. I would do a little bit with the conventional side, and I would do quite a bit more with the holistic side, and then I would marry the two together so that you're getting the best out of both worlds, and you're maybe making a little bit more use of your insurance on this end. So I hope that this helps you manage your IBS more effectively, and I can't wait to hear about it in the comments down below. Tell me all the things. Tell me if you have been stuck in this band-aiding and calling it treatment limbo with the conventional medical world, because I've seen it a lot with my patients. And tell me if you have worked with a holistic practitioner and had them recommend a crazy restricted diet that apparently you're just supposed to stay on for the rest of your life. God knows why. So tell me all about it in the links below. Thank you so much for tuning in, and I will see you in the next video. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.